G'day viewers, welcome back to QXR, the Professor Files. Thanks for that lighting over there. I'm your professor and I'm going to show you what is required when we're doing a enema, rectal tube enema investigation. If you come over here, come over, don't be scared. This is the equipment we're going to use. So, we've got three types of enema tube here. We've got a non-balloon, a pediatric Foley's non-balloon, or we have a balloon. Now you need to check with your radiologist or senior radiographer with which one you are going to insert. When it comes to insertion, this is a dual procedure, so either a radiographer or a nurse can insert a rectal tube. Now let me show you this. This is called the balloon inflator. This will go on our third one here, which is, you see the plastic around there. So watch what happens when we inflate this balloon. So when you're doing the investigation and this is all hooked up to your tubing, you place that in to the rectum and then you inflate like that and then you clamp across and see how big that is, and that's why your tube more often than not will not fall out. So it's very important that you also do not throw these away. These are reusable, much like this one here. So this one here you're asking, this is a air inflator. So just say you've inflated your bag, make sure you put the lid on and you've inflated your bag and you've used up all your air and you've done a pre-scan in CT or fluoroscopy and you really don't have enough air in and you've inflated a bit of air and you need a little bit more, you will have your balloon air inflator tube and you'll get your air inflator, you'll attach it to the blue part of the enema tube and you will just inflate, because this has got a one-way valve inside, so the air will inflate the intestine and you'll have plenty of air. So, can you feel it, Kimmy?
I feel the air.
Yeah. Righto, so getting back to the bags. If we're doing a CT colonoscopy, it's very important that with any tube, this is whether it's fluid or air, that you usually have one hand space from the clamp. This is so when you've got the patient in, you can like control the clamp, turn it on, turn it off. Plus you don't want a whole heap of this air going in when you're doing a contrast enema, okay, because it just interferes with the imaging, okay, no one wants that. So let's go over and let me show you what you need to do. So we've got two outlets here. One is oxygen, one is air. Never use oxygen, it's a no-no. So no to oxygen, but yes to air. See, yes, so what we do, we put this bag on the ground, hook it up onto there, unclamp and inflate. Inflate it to full and clamp off. Now that we've got our bag of full air, there's two types of tubes that you can insert or use. You can either put your tube on without a balloon and hope for the best that it doesn't fall out, or you can inflate your balloon, like so. Look at this, it's very fiddly and hard to see when you need glasses. See, balloon. No falling out, no mess. I go for this one every time. But there you have it, those are the two sorts. But also make sure that you put your sheets underneath the patient before you begin, because no one wants a mess. Now we've taken this tube out at the very end. We'll just pop back our balloon tube, but it doesn't really matter which tube you got. Let the balloon come down before you pull it out. We don't want any screaming or injuries. Okay, so we pull it out and the patient's lying on our blue towel or our pinky. I often like to use the pinky because it's bigger and it catches more mess. But usually with these CT colonoscopies, they're usually pre-prepped, so there's not much of a mess. But if you're using contrast, that's a different story. And then you pull it out, and then you can dispose of all of it just like that, straight into your clinical waste bin. So easy. But remember, never insert this in dry. It needs to be moist. So we'll lube it up with a bit of little lube. Don't be stingy. Put a fair bit on and then glide it in nicely. Okay, when it comes to inserting the tube, make sure to explain everything to the patient. Make sure you're wearing your gloves. Then we're going to roll them to the other side so that they're facing away from you. Please roll over to that side. Then we're going to get our tube all lubed up. We're going to keep privacy. Make sure at all times to keep privacy. Grab a towel. And then make sure you're the only person there. You get everyone out. And then you're going to insert the tube towards the belly button. Okay?
Make sure I'm in the fetal position.
And the fetal position, as you can see, knees up towards the chest. Thank you. That's it for this tutorial. Thanks for watching and see you next time. Bye!